Do you know that cervical cancer is one of the most preventable cancer in the world? Yet thousands of women get diagnosed every day with cervical cancer, of which there's been a lot of awareness being created on how to prevent these cancers. Hello everyone, you girl Sandra. It's been a while, I know, I'm sorry. And welcome to my YouTube channel. It's good to have you here with me today. And I'm so sorry for missing in action all this while. Yes, I've been missing and I really apologize for that. It's not been intentional. So, as you all know, my YouTube channel was bettered from the passion, to create awareness, to talk about different topics relating to nursing in particular, because I'm a nurse and I enjoy being a nurse. And I also do love being a nurse. But today, I'm going to leave the educational bits, or talking about, how to migrate to the UK, how to become a nurse, how to change career. I'm going to leave all of that and actually talk to you today about cervical screening. Do you know that cervical cancer is one of the most preventable cancer in the world? Yet thousands of women get diagnosed every day with cervical cancer, of which there's been a lot of awareness being created on how to prevent these cancers, or what to do, to prevent that from happening. And one of the campaign, especially in the United Kingdom, in the UK, in England, even other countries, has been encouraging women to go for their cervical screening or go and have a pap smear. What is cervical screening? What is all this fuss about it? As a woman, or as someone born biologically as a female, you have a cervix. You have a cervix. So what that means is, young woman, they always advise from childbearing age, or from once you become sexually active, you need to go for a pap smear. A pap smear test. If you're in the UK, your GP would send you, an invite to tell you to come and do the cervical screening. And when they send you that link, inside that letter, they always include a pamphlet or leaflet or a booklet containing basic information you need to know about a cervical screening or about having a pap smear test. So what does this test do, or how is it performed? I've gone through the test. I've gone to do the test. And one of the things, fine, a lot of people may say the test is uncomfortable. It's not painful, it's uncomfortable. Uncomfortable because obviously it has to do with your private part, with you going to your GP. There's going to be a chaperone there, and then them getting to check you. Basically they would explain the easy procedure for you, get you to undress. A nurse will be there to reassure you, and then when they reassure you, you give consent and you get a doctor or a senior nurse to take a pap smear sample from you. And that means they would put something like a speculum to help open your vagina so they can have a clear view of your cervix, and then collect a sample. Now, what happens to this sample? This sample is sent to the laboratory and is then tested and checked for something called an HPV virus, or abnormal cell growth. Now, research has shown that most cervical cancers has been caused, or most of them has been caused or related to having the human papilloma virus, which is the HPV virus. Yes, there's been a lot of myth about this virus, and some young ladies believe that you need to have multiple sexual partners to have this virus. Please, that's not true. You can be married for 20 years and still test positive for this virus. It's not You testing positive for this virus does not mean you've got multiple sexual partners or you're promiscuous. No, that's not what it means. Please, let's stop that. What that means is you tested positive to this HPV virus, and then treatment is being provided for you. You're going to go through a treatment, and then you go back for a repeat test. And when you go back for the repeat test, that brings the results comes back to tell you if it's positive or if it's negative. Why the fuss about all of this? Now, cancer has been something that a lot of people, I don't know if you know, I work in healthcare and I see a lot of young people get diagnosed of cancer. It's basically like a topic people do not talk about. But if you actually find out from your friends, you find out that they know someone or heard of someone or who got diagnosed of a cancer, whatever stage, breast cancer, whatever type of cancer. Cancer is something that's really in the society right now, and it's causing a lot of heartache, a lot of pain, a lot of scare. What can we do differently? Is it the food we eat? Is it what we're not doing right? I can't answer that. But what I can tell you is, if you're a young girl, you're a young woman, please go get tested. Go for your pap smear test. Go for your pap smear test. Take your health really seriously, because these little things you can do help to prevent, or at least creates the right awareness for you, and you know for truth, okay, yeah, I've gone for my test, I've gone for my pap smear test, or the test came back positive, or the test came back that, I had an HPV virus, and definitely you get treated immediately for it. Now, this abnormal cell growth, this is what, if left untreated, can eventually cause a type of cancer, can eventually lead to cervical cancer, which you do not want. A lot of times, me working in healthcare, I've come to realize that sometimes people as human beings live different symptoms they may experience, too long before actually escalating or getting help. They wait, they ignore the headaches, they ignore the pain, they ignore the swelling on their body. It's normal, I just need to rest a bit. Oh, I think it's okay. They keep creating these excuses and not actually seek professional help and get tested or get checked. Because when you get checked, when you get tested, when you go for your blood work, you book your blood test, you go for all these things, it helps reassure you that your body is in good health. It's that reassurance. It creates that reassurance for you. Yes, you can't really prevent some of these things. Agreed. But how will you feel if you go see your doctor and your doctor says to you, oh, I've checked, your blood test came back, and I think I may need to place you on some sort of treatment because there's something detectable in your blood test. That's more reassuring, because you've done everything you can do as a human to stay healthy, than leaving things to a game of chance. Bear in mind that an headache could easily be treated if reported, than when it becomes something big, if that makes sense. Especially now that if you're in the UK, you know that the waiting list is long. There's a lot of things going on about waiting lists, about how difficult it is for people to access healthcare, or how difficult it is for people to, call their GP and get attended to. I understand all of this, but at the end of the day, it's your health we're talking about. It's your body we're talking about. If you leave these things and not do the right things you're supposed to do, and then you get an health scare, you will live your life asking yourself questions of, if I had known, I should have done better. I feel like most times we do not take our health seriously. Especially if you're practicing Christian, or you hold on to a particular faith, you just believe that, oh, God is taking care of everything. Yes, He is. But the reason is giving you your own willpower, is made all of these things accessible, available to you, is for you to use it and look after your body well. And one of the ways to look after your body is at least have an idea what your blood pressure looks like. Have an idea what's your normal blood pressure. A lot of times, take a survey, go on the street and do like interviews on the go, whatever you want to call it. Interview 1 in 10 young persons. They will tell you they don't even know what their blood pressure is. If you ask them, are you diabetic? I don't know that. I don't think so. Is there any family history of diabetes? I think I grew up seeing my dad always checking his blood sugar and all that. They don't know these things. You know, there is, I think a lot of times we assume people are healthy just because they've not fallen down on the floor, you know, just because they've not landed in hospital. So we make that assumption to say, oh, I'm healthy. I'm perfectly fine. I'm a young person. What could go wrong? But the truth is now, most of this healthcare diagnosis, hypertension is not just for old people anymore. Diabetes is not for old people. Young people do get sick. But if you get sick and you go to the hospital, if they check your blood pressure, if you're able to tell the nurse attending to you to say, oh, what's my blood pressure? And the nurse says, oh, your blood pressure is 130 over whatever. And you're like, oh, okay, that's within my normal. How will you know you're normal if you don't check? You would not know what's happening in your body if you do not check. It's not about you. Some people will say, well, what you don't know don't kill you. It will kill you, because at the end of the day, a blood pressure that keeps going, if your blood pressure, if you're hypertensive and you go about your daily life without getting checked, without getting treated, guess what? One day, that hypertension may lead to a heart scare. That hypertension may lead to something else going wrong in your body. Before you know, your heart begins to, you know, the hypertension affects your heart. So it's this roller coaster. You don't want to eventually cause problems in your body if you don't go for testing. And listen, people, young ladies, it doesn't matter if you're very reserved or, you know, you're not very outgoing. Please go get tested. If you go to the clinic, you go to your GP to get tested, you are allowed to have a chaperone with you. It's not you and the doctor. They would even ask you, you can even request to say, I want someone else here with me, because that will make me feel confident. And it's not painful. I've had a pap smear test. The good thing is, if you've had a pap smear test, depending on the result, that would determine how regularly you're supposed to have a test. Depending on your family history as well, that would also determine how regularly you're supposed to have the test. For people who do the test and the results come back being normal, you have to test every 3 years. But if your result comes back to say, oh, you tested positive for the HPV virus, it's not a death sentence. It just means the same professional or the same doctor who gave you the result to tell you it is positive, this same doctor will make an arrangement for treatment for you. Please take your health seriously. Don't live your life as a game of chance. We hear a lot of sad stories, and then when you find that, oh, actually, a couple of months ago, I've been noticing, I've been losing weight. Did you go to the hospital? Did you call your doctor? Did you find out? Did you go for tests? No, you didn't. I don't think it is fair for you to live your life that reckless. Don't be reckless. Go get tested today. It doesn't mean you testing positive means, oh, you've got 3 partners or multiple sexual partners. That does not mean that. It doesn't mean that. I've seen a lot of people who've been married for a couple number of years and they still test positive to the HPV virus. And what do? They get treatment. That's what happened. They get treatment, and once they get treated, guess what? They go back for a repeat test and the result comes back negative. So, this is me saying to you, with love from my heart, please, 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 book your pap smear test today. Call your GP, book an appointment with the nurse, and go for your pap smear test. And follow through. Don't miss your appointment. please don't miss your appointment. Follow through when you booked an appointment and go for the test. Go do the pap smear test. If you want, you can go with a relative, someone that you think, okay, it's going to make you feel calmer, you know. Or if you're going by yourself, you can ask for a nurse to be with you in the room. And trust me, it's not painful. It's awkward, yes, because someone is looking down at your vagina. Yes, that makes it awkward. But is it painful? No, it's not. It's not painful. So this is your cue to please go for that cervical screening today. Go get tested. Have a pap smear test. Oh my love. And yes, I'll try my best to post more videos and become more and more active. Thank you. Thank you to everyone who has subscribed, who shares my video, who has asked questions on my channel. Thank you. I really appreciate it. I do not take this love for granted. Do subscribe, like, follow, and share. Kiddos, love you.